Humans spend about 90% of their time indoors, and some viruses such as influenza and SARS coronavirus 2 are transmissible in the indoor environment. Qualities of buildings such as temperature and humidity can impact the environmental persistence of viruses such as influenza, though the seasonality of virus transmission tends to be both virus-specific and impacted by a multitude of environmental and non-environmental factors. Any possible seasonality of SARS coronavirus 2 transmission, as well as the relative importance of indoor temperature and humidity on the risk of SARS coronavirus 2 transmission, has yet to be determined. Therefore, the temperature and humidity in buildings should be maintained within ranges recommended by organizations such as ASHRAE. Further, the impact of ventilation design and filtration on reducing the risk of SARS coronavirus 2 transmission is recommended to be the focus of future research. I am Dr. Nicholas Clements, Senior Director of Building Sciences at the Well Living Lab and Research Affiliate with the Mayo Clinic. I am a co-author of a perspective piece for the Mayo Clinic Proceedings titled Indoor Environment and Viral Infections. While some viruses that can be transmitted in buildings exhibit seasonal patterns and can be impacted by environmental conditions, such relationships have not yet been established for SARS coronavirus 2. As evidence emerges of possible short-range aerosol transmission of SARS coronavirus 2, research efforts should focus on ventilation and filtration as possible interventions for mitigating virus transmission indoors. Optimizing building management to minimize the risk of SARS coronavirus 2 transmission is critical, especially in buildings being used in the clinical practice. To reduce the risk of airborne transmission indoors, healthcare engineers can ensure ventilation systems are operating correctly by verifying design flow rates are being met, as well as by ensuring that the installed air filters have both a high filtration effectiveness and are installed without leaks. Healthcare engineers should continue to follow guidance from organizations such as the US CDC and ASHRAE regarding recommended ventilation designs, filtration methods, and air disinfection technologies that can be implemented during the pandemic. By carefully mitigating the risk of SARS coronavirus 2 transmission that may be mediated by indoor air and surfaces, patients can be assured that the indoor environments they encounter in the clinical setting are as safe to occupy as is possible. The Well Living Lab is currently pursuing research on reducing the risk of air and surface-mediated virus transmission in the office environment. This research will leverage the lab's reconfigurable research modules to test various desk configurations and ventilation designs. We are also pursuing research to understand the psychological impacts of returning to the office environment during a pandemic. More information about these efforts can be found at the lab's website, www.welllivinglab.com.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.